Good morning, friends. I am Dr. Vishmay Kumar, consultant nephrologist. Today, on the occasion of World Kidney Day 2021, we are discussing that kidney problem is a huge problem. As of today, 850 million patients or 885 crore patients all over the world are suffering from some form of chronic kidney disease. That means every 10th individual is having a kidney problem. And this problem is not even for the patient but also for the relatives who take care of these patients. The journey of chronic kidney disease, or you can say the life cycle of chronic kidney disease, starts from the stage of microalbuminuria, where a small amount of urine keeps on pouring in the urine. And this micro goes to macro, which is macroalbuminuria, and from there is no return or no back care. Patient starts his journey from chronic kidney disease stage 1, stage 2, stage 3, goes to stage 5, and stage 5 is a stage where you need dialysis, which may be a peritoneal dialysis or a hemodialysis, and if you are lucky and you procure an organ, which can be live or cadaver, then you can undergo a kidney transplantation. And beyond kidney transplantation, the life is even more challenging, where you have to be in a very strict lifestyle, you have to be very strict with your medications, your follow-up, your investigation, you follow your doctor's advice. Still rejections happen, and then you go into further chronic kidney disease, and then you are even more lucky you can get a second transplant. But you see, the whole journey is so challenging. There is huge amount of financial pressure as well as social pressure involved. So life is impacted in these kidney patients. Their participation in the daily activity becomes limited. They are fatigued, they have pain, they have depression, they have gastrointestinal or stomach problems, they have sleep problems. So is this life going to be the same way, or we can improve this quality of life? That's the theme for 2021 World Kidney Day. There's a new way of thinking to act against the disease. We have to see not just the disease. As a physician, as a doctor, as a relative, as a caretaker of the patient, you have to think about patient's priorities, patient's values. You have to empower your patients. You have to make them live, participate in the social activities. Living with kidney disease is just not the saying or a prescription, it's an art. You have to inform them about the effective symptoms which they can face. Patient should have all information for a proper decision making. Once he enters CKD1, he should know what is CKD2. Once he is into CKD stage 4, he should know what is dialysis. Once he is into dialysis, he should know what is transplantation and how to take it. So you have to inform them in future. So they are not taken by surprise, because they are not the first patient facing the same problem. There are a huge number of patients who have gone through the same life cycle. So they should be informed with effective communication between patient and doctors. So ultimately it's a holistic approach. Patient should be able to manage their pain, their sleep disorders, their anxiety, depression, stress, their mobility, their frailty. All this is only possible when they can communicate with their doctors. And we as doctors, we have to stand with them more than their own relatives. We have to educate them. We have to educate them with all the management of these diseases. We have to inform them that these are the problems which you can face, and you can definitely communicate with your physician to effectively control these problems. So patient empowerment is the theme of 2021 World Kidney Day. Partnership, communication, improved communication. That is how you can live with chronic kidney disease. So friends, life is possible with chronic kidney disease. It's just a disease, is nothing else. As a human, we can enjoy social life, we can enjoy participation in different activities. Whatever you want, you can do, but you should be in the frame of the disease. The requirement of the chronic kidney disease or the requirement of the renal problem should be there in your mind. Your different stages, your requirement of your medicines which should be there. Your diet information should be adequate with you. Then definitely life is possible and a very happy life is possible, and depression will be no around in any of these kidney patients. Thank you very much. So I close the talk over here, and you're most welcome to communicate with me if you have any issues. My email ID is projected at the end of this video. Thank you very much.